You're listening to the Tooth Sleuth Podcast, all about the business of dentistry, hosted by yours truly, Greg Essenmacher, a fixed full arch dental expert and founder of G&A Consult, speaking with industry leaders on the dental landscape from their perspective. At G&A, we specialize in transforming full arch dental practices, teaching, coaching, and training teams to deliver an exceptional patient experience, from that first call to delivering final smiles. Whether you're a practice owner, a DSO executive, or a regional leader looking to expand your full arch program, boost same-store sales, or unlock the true profitability of full arch cases, we've got you covered. Ready to see how full arch can elevate your practice? Visit the show page or book a discovery call today. Let's turn your potential into results. Welcome back, everyone. Tooth Sleuth Podcast. Greg Essenmacher, your host. But you know me, I think. If not, you know what I want you to do. Like, share. I don't know what else you'd do. Maybe just like and share. Possibly. Subscribe. Oh, that's what it is. I am super excited today to welcome onto the show somebody who knocks him down and picks him back up. Isn't that what I said to you, Richard, in the green room? Isn't that what your profession is? He's a dental anesthesiologist. It's Dr. Richard Marn is my guest today on the Tooth Sleuth Podcast. Welcome, Richard.
Thank you. Thanks for having me. I don't think I can carry the title of dental anesthesiologist. I don't have that cachet. I'm just an anesthesiologist.
A board-certified pediatric anesthesiologist. Yeah, well, if you want the whole title, we were talking titles in the green room. Dr. Richard Marn.
Just for clarity, I'm just on the physician side. So I don't actually have, just to make sure people don't think I'm a dentist, I don't really have the dental knowledge that people assume that dentist anesthesiologist has, unfortunately.
I mean, but you've done like how many? 18,000 cases, right? And like at Johns Hopkins and NYU and Mount Sinai and the greater New York area. I mean, do we want to really start throwing these around, Richard? Is that how you want to start the show? I mean,
if you want to name drop, go ahead. I'll just be silent over here in my little corner.
Well, and your big thing. So the reason, Richard, and that you're on the show, I mean, among and lots of reasons, right? But the big thing is that you love to talk about that no patient, especially a child, should ever suffer irreversible harm in dental or oral surgery setting again, right?
Yeah.
I mean, when you talk about that, when you live it, when that's your passion, right? That no harm should ever come to a child when you're talking about this type of thing, right? Why don't you just start there and talk about that piece of it, and then we'll go back because I want to hear about your origin story of how you came into this.
Okay. Okay, good. Fair question. Here's some data. About one patient per day in the United States dies due to a medical event that starts in a dental or oral surgery practice. Right? So that's about 350 or so people on average per year that has a irreversible, death in their, that starts in the dental office. Okay. That does not include the near misses. The near misses, and what I mean by that is people that had a medical emergency that maybe almost got close to dying. That number accounts to about 5 to 8 times that other number, 350. So that you'll get to about 3,000 to 4,000 medical events in this country per year where someone has died or almost nearly died because of something that happened in the dental office. And unfortunately, it's underreported. And this is not common knowledge because this is kind of knowledge known amongst a lot of malpractice insurance companies that maybe don't show this or share this information as much for personal or business reasons. But the point is, this is happening, and that is really what I'm trying to address with what I think I can do in this industry.
Well, it's not really water cooler talk, right? I mean, they'll talk in my lane, in the fixed full arch lane, the all on X, right? Everybody wants to go to conferences and talk about, oh, I'm doing 8 or 10 arches a month. I'm doing 20 arches a month. Oh, look at all the money I'm making. Look at the car I drive. Not really talking about, oh, I almost lost a patient on the table today, right? But you do hear the whispers of, oh, did you hear about so and so? Like
Yeah.
they had a patient who fill in the blank. It's that quiet whisper that happens every once in a while. And what I'm hearing you say is that this happens a lot more frequently. So let me just ask the bold question because, I don't have that much knowledge in this area. And I'm guessing many of my listening audience doesn't either. What would you say that the percentage of those, let's just say the near misses, if we're talking about 3,000 or so, what would you say the percentage of those are preventable in a common layperson way?
Honestly, Greg, I don't know. It's
Okay.
hard to assess, honestly, because it's not being tracked, and we don't have the data is not readily available, um, especially to the lay people or even people in the profession. It's very difficult to get this kind of information, and so it's hard to say what is really preventable. The way See, the way I look at it is there's there's a culture in the dental industry which tends to have a heavy emphasis on prevention. Not to say that's not important, but there's this emphasis, and to me, maybe an overemphasis on prevention. Well, let's do this, let's do that, and let's prevent it. The fact is, even with the best teams, with the best dentists, with the best plans, things can always happen. And the question is, can that team respond in that moment properly as best they can because they're prepared? All right. Um, and so therefore, it's not necessarily about to me, it's not completely about prevention. That's just a component. It's about performance in that moment and how do you get to that moment? How do you get that performance in that moment? So unfortunately, I can't answer your question because I don't know. And but could more preventive measures be helpful? Sure. I just don't know what that number would be.
Well, and so the word responsibility, right? We hear the word responsibility all the time, and I know just in my world, I hear the word responsibility and I break it down to respond with ability. And what I'm hearing you say is that when something like this arises, right, an emergency situation, if individuals and teams are prepared
Yeah.
in an emergency, then they
Yeah.
can respond with ability. So, talk to me a little bit and my listening audience about what it looks like, how you help teams to respond with ability, to be responsible with responsibility in those situations should they arise.
Right. So the way I look at it is there's four pillars for emergency, and especially for sedation emergency preparedness. Four pillars, all right? And this is how I kind of break it down. And this is my outlook on how to address this. And I'll tell you where I think a lot of people in the dentistry are in this kind of this preparedness. One is infrastructure, right? So what is that? I'll just lay it out. Infrastructure,
Please.
co- competency or competence. Number three is culture, and number four is habit. Okay, so let me, if you don't mind, I'll just take a minute here to break it down. Infrastructure, um, it's what you have, it's the material aspects, it's the makeup of your environment, and the physical aspects. So one acronym that I created is what I call MESV. MESV. What is MESV? It's your medications, equipment, supplies, and visual aids. Right? Visual aids are kind of like when you do CPR or BLS, you have that little code card to help remember things. That's a visual aid. Or maybe you have um, a standard SOP, and in that SOP are algorithms to help you with emergencies. That's a visual aid or cognitive aid that we sometimes see in simulation education world. So that's infrastructure. Other things are: do you have the right lighting? Do you have the right ingress and egress? Is your place easy to find? Okay, I'll give you a quick example. There was a medical emergency here in New York City that I know about, that I heard from someone firsthand, and the paramedics could not find the office. They went to the wrong floor
Mm.
because there was infrastructure wasn't set up correctly. They didn't have someone, or there was no correct identification where to go. So that delayed um, better care in an emergency situation, right? So that's infrastructure. Number 2 is competency. So that's what a lot of, I would say, dentists in general focus on, is their competency. And a major emphasis on that is BLS or ACLS or PALS, which is vital. It's important. It is critical, but it's not the end all and be all. So do you have the right certification? Do you have the right people to have the right certifications in those areas? But it's not just that. Do they actually know how to respond to a crisis? Do they have the competency of individual members knowing their roles? And do they have the right leadership in a moment? So leadership in a crisis is a little different than leadership in a non-crisis situation, right? So because
Yeah, people respond differently in a crisis. Absolutely. Yeah.
One of my mentors would say to me, or one of his taglines is, when emotions go up, intelligence goes down.
Yeah.
When emotions goes up,
It's our limbic
intelligence
brain
goes
or
down.
something, right? Takes over. It's just that animal instinct piece.
It happens to the best of us. I see it in
Yeah.
anesthesiologists. I see it in ER docs, paramedics as well, depending on the situation. And so it's definitely going to happen to a dentist or oral surgeon who maybe has never seen a real medical emergency, especially in their office. And maybe they're really the only person there dealing with that and knows what to deal with that. So do they have the competency as a baseline, but also as a team? Do they have the team competency to know what roles are, how to use resources? Do they know how to assign roles and how to choose leadership? What if the dentist is the patient, for example? Okay, so that's number 2. Number 3, culture. So culture is just another word or some version of saying teamwork. Do you have psychological safety in your team where someone can speak up so that if they notice something is not quite right, that they feel safe to do so, right? So if there's a sedation emergency going on and the assistant, but not the dentist or surgeon, notices the pulse oximeter is not on, has the leader made it safe enough for them to speak up? Or are they going to say, you know what, I'm going to not say anything. I'm sure the dentist or oral surgeon will recognize it. I'll just wait until they tell me what to do. That's psychological safety, which, by the way, has been very well described.
Or they get a response mechanism that they've had in the past where it was maybe not the best response, so they're just not going to say anything this time because they've had
Exactly.
that response where, maybe some anger or frustration or how dare you challenge me? I know
Yep.
what I'm doing. So yeah, those two. Absolutely. Okay, so those are the 3. What's the 4th one again that you mentioned?
4th one is habit,
Habit.
which I think is under. It's a little under. It doesn't get as much recognition as it should, right? And if you want to get good at anything, it has to be a habit. I mean, I can't imagine you being a high performer with a certain skill set and not having a habit to do so. And so a habit is what are you, but also your team are doing on a consistent basis, either day on day, week to week, month to month, year to year, to make sure that habit for a sedation emergency preparedness or readiness is in place for your practice. So I'll give you an example of what I do. I have a clinical company. It's called New York Medical Anesthesia, and we do mobile sedation services for dental practices, especially for people that are taking care of kids. And what I do is every office that I work with, every quarter, if not almost every day, and we do a little huddle. And we literally talk about what if scenarios. And so the reason we do this is I make it a habit so that every time we come together, they're like, oh, okay, Dr. Marn, he's going to be coming to our office. I know we're going to have a little huddle and we are going to talk about some topic that he will introduce to us. And so they get used to that sense that we start viewing sedation not as nothing will happen, but rather assuming something will happen. And therefore, what are we going to do? What is our roles? What is our skill sets that we're going to employ? And so I make that the habit from the people I work with, the teams I work with. And that is just something that naturally, we used to do it once every quarter. Now I'm basically doing almost every week. But again, that's a habit.
Yeah, and I love that part of it because when you do the habit, right, to get good at something, my good friend Dr. Uche, who's fitness speakers, he talks about creating, and others, of course, but I just immediately thought of him. He talks about creating the unconscious
Mm,
consciousness of this, right, so that it just happens naturally. You don't have to think about it, so you can spend your thought, you can focus on what's happening at hand, and enough people that just go into autopilot, if you will, in what are the next steps in this
right.
situation, especially when emotions are high in an emergency situation, so critically important for that. So the four pillars that you laid out, I thought it was beautiful, right? So the
Thank.
infrastructure with the CPR, and I'm familiar with CPR. Took CPR
Sorry,
training
Greg.
very recently. No, quite all right. I took
It's
CPR
fine.
training recently with my first grandson coming in a couple of weeks, and so we were
You're
asked
a
to do
grand.
infant CPR. Well, I will be in a few weeks. Yes, I know.
All right,
Thank you.
congratulations. Oh,
Preserving well.
that's
Uh,
impressive.
yeah. So, and then the second pillar of competency, which I think is so critically important, which you touched on, and then culture, the teamwork, and psychological safety. And we had a little exchange there, and I know my good friend Jonathan Bonanno talks about this as
Mm,
well. So, with all these four pillars that you're talking about, what I want to know, and I'm sure my listening audience is, so how have you seen this really affect? Because I no doubt that this is something that you're passionate about, but I'm sure you also teach this, right? And
yeah.
have programs for implementation of this. How does this affect? How have you seen this affect bottom line for practices and owners that you've implemented this for? What's the real world scenario? Because I'll just be very honest, right? Sounds good in theory, but how is this actually going to affect my business in a positive way? That's what I'm sure my listening audience probably like. Yeah, this all sounds well and good. You created another program. Greg brought somebody else on who's got something that sounds great. So talk to me about that real world implementation pieces of what
Mm.
you've seen happen, because I think that'll land really well to hear that.
Well, I can tell you that addressing these four pillars in a dental world is brand new. No, no one's really doing this. A lot of the preparedness for sedation emergencies in the dental industry is focused on mainly the first two. Making sure I have all the medications, equipment, and supplies and visual aids. Oh, okay, I got that. And number two, competency. Oh, I have BLS. That's enough, right? So they're addressing some of that, but the latter two pillars are less likely and less often addressed. Partly because a lot of people don't recognize that. So it's hard to say in the dental world what impact this has, right? However, if you look at the medical world and you look at um, uh, preparedness for emergencies, it actually has notable impact, right? And yes, we're still learning because simulation is relatively new, especially in clinical medical education. So, a few years ago, I think it was 2022 or 23, there was a paper that came out um, that showed, and what they did is they looked at um, um, uh, simulation training at the Harvard hospitals, especially at obstetric locations in Boston and Boston area. And they found um, an improvement in overall outcomes and better teamwork, right? Such that the malpractice insurance company for all the Harvard hospitals require medical simulation training across the board for all their teams. All right. So it's not just you have to do BLS or ACLS or PALS. You need to do all your teams, obstetrics, anesthesia, all right, and some of the staffing need to do simulation training because they want to make sure they are protecting their bottom line. This is a major insurance company in the Massachusetts area, and saying that there's enough evidence on their end that they're willing to pay for these programs. And by the way, if you don't do it, you're not going to get you're going to have a higher premium for your malpractice
Mm.
insurance. Okay. So again, do I have all this data off? Honestly, I don't, honestly, but there's enough other data in the medical world to indicate simulation training for medical emergencies shows there's enough data that major insurance companies are requiring it for their hundreds of thousands of participants. So
Well, and what I hear you
that's the best I
say,
could provide you right now.
no, no. Well, and here's the thing, right? Because there's parallels absolutely to be drawn between the two. And what I'm hearing you say is that it's the stuff, the supplies in the first two pillars versus leadership in the second two pillars. And so,
Mm,
how do you measure, right, on a P&L statement leadership? Well, you really can't. Just
yeah.
like in what we do at GNA Consult, it's like, how do you measure a good leader? Well, I mean, if we reverse engineer it, and I speak about this all the time, case acceptance is driven by the patient experience, which
Mm-mm.
is supported by team development, which is led by leadership. And
Yes.
so, well, how do you put a number on leadership style? How do you
Yep.
put a number and metrics on team development? Well, you can certainly put a number on the metric of case acceptance. And so it's kind of the same, right? As drawing the parallel, it's like, well, which one is not like the other, right?
Mhm.
Like in Sesame Street, everybody learned, well, if which one is like the other? What parallel can we draw from that, Richard? And that's what I'm hearing really is that sure, the supplies are necessary, but if it's sitting in the corner collecting dust, then it's not really a tool. It's something that you had to have in order to get a piece of paper saying you could perform something.
Yeah.
Well,
Yeah.
it's not really something that is useful as, well, it's not even a tool, right? It's just something that you had to get rather than something that you're implementing and integrating into your practice. And so
Right.
I'm picking up what you're setting down. And I know my listening audience is very savvy and they probably picked up on that as well. And so not necessarily a metric necessarily. So let me ask you this because this we run across this with clients that we work with and hear a lot of this often. What would you say to a dentist, a surgeon listening to the program today of how could they improve that we'll call it, I mean, I think you call it like emergency readiness, if you will, right?
Yeah.
To be more prepared without feeling this sense of, man, that seems like a tall mountain to climb. Like I've got enough on my plate, just trying to level up my clinical expertise and like dealing with staffing issues and worrying about my bottom
So
line and without like another thing added to the plate. Like what could you say to them at this point if they're listening still?
so I get it.
Which you better be.
I hope they didn't drop off from about 3 seconds
I
ago.
hope so too.
You look at your data. Whoa, what happened there?
Right. What happened there? Oh, he got to the third pillar and it just fell. It tanked. Oh, that's all right. No.
Um, incidentally, my wife's a pediatric dentist. And so I do sedation with her, and of course, I hear about her challenges as a practice owner. And it I admit, you know, m- uh, emergency preparedness is not at top of mind for a lot of people. It's not. You're dealing with as an employee, as an employer, you're dealing with staffing issues, regulations, meeting, payroll. It's you got a lot of other things that are on your day to day mind. Um, and I will say, I do think I feel need to say that at some point this does need to be addressed because this is to me of all the problems and all the challenges that you have as a dentist, whether it being patient complaints, staffing complaints, or problems, payroll, as I mentioned, regulations, the latest clinical data. There is no single event in my mind that will destroy your career than a emergency that goes wrong, that is poorly handled. There's none. The impact is so profound that it affects not just your clinical work, but your revenue, your culture, your employee morale. And so, basically what you're asking is what can be done at a very basic level. All right. So I'm going to provide two different things. Right. And number one, I want to say start with a little measurement. I know it's challenging to measure things that we just alluded to earlier in the conversation, but there is a way to at least get you in the right mindset with a measurement tool. So we can put in the show notes, but I actually help create a emergency scorecard, a medical emergency scorecard that assesses you and your practice privately. No one knows this except you. Goes through 20 or so questions, addresses the 4 pillars, and gives you a sense of where you might be personally or as your team for a medical emergency. It's actually initially designed for pediatric medical emergencies, but the principles are the same. So if you take it, it doesn't matter what kind of dentist you are. You'll get the sense that where you are in the realm of preparedness in those four pillars. It takes 8, maybe 9, 10 minutes to complete, but it gives you a sense of where you are. It gives you a score in each of those pillars. Gives you a cumulative score, and it also gives you a PDF document. It's like 10, 15 pages if you want, and it gives you recommendations what how to proceed forward. Like, all right, how do you address maybe some of your weaknesses or strengths? Okay, that's number 1.
Love that. Yep.
All right, that's something that's very easy. We'll put in the show notes. It's like emergency.scoreapp.com. All right, it's I think that's very useful. My wife really enjoyed it, and so as the rest of my clients. Number 2, start having basic huddles with your team. It's so simple. It takes a few minutes. Start opening the floor for discussion. You don't have to do it every day. You don't even have to do it every week, but just start. Listen, just have a basic question. Hey, everybody, if we have a medical emergency here, what do you think? How do you think we would handle that? What do you think you would do? What do you think I should be doing? And just open the floor for discussion. And if you provide the psychological safety to speak up, you'll be surprised the vast amount of holes, potentially, but also strengths that your team will recognize just by opening that opportunity up to discuss. So those are the 2 basic things I usually start with when people ask me, what can I do right now? It doesn't cost anything but a little bit of time.
Yeah, I love that, and we'll make sure that that tool gets in the show notes. I love that, and then your recommendation of the huddle, and all my listening audience knows that I am a big proponent of huddles daily. But I know you said you don't have to do it daily, but yes, I will. I will lift that up and say integrate that into your huddle. But if you're not doing a huddle and you're opposed to doing a daily huddle, at least like what's recommended here by you, Richard, for sure. Just so I don't have to be like opposing what a doctor says, what Dr.
No,
Richard
but what I
wants.
mean
So,
by
no,
the way
I just, I'm
is
kidding. I'm
more
just playing
the
with you a little bit, but this is a good transition though, because now I get to put you on the hot seat, Richard, because this
boy,
is
is
the
it
point of the
hot.
program. All of my guests play a little something called "What the Sleuth is Going On." It's 3 rapid fire questions. First thing that comes to mind, and you're a listener of the program, so you already know this. Are you ready to play?
I think I might be ready. Go ahead.
All right.
Send it
Question
my
number
way.
1. What's the worst bad breath you've ever encountered?
All right. So there's a number of opportunities where I've had that pleasure, but I think what most mentioned is a 5-year-old boy who we had to do a full mouth dental rehab on. And
Oh,
boy, we were wearing 2 of us were wearing 2 masks. Another person was wearing 3. It was, and the fan was blowing, and we had some aromas going on. It was kicking because they had such terrible mouth decay. Um,
for a
but thank
5-year-old.
God, yeah, thank God we were able to take care of this little guy. But oh,
Yeah,
it was powerful. So that's
that's
I
tough.
would go with that as my answer.
All right. All right. Question number 2. If you could change one thing about your smile, what would it be?
Oh, this one I actually did not prepare for. Could I see my height? Can I change my height?
The heart of your smile. My smile is too low to the ground, so I want to change
Can I
how
just
far
raise the height?
vertically my
Yeah, my vertical distance from the ground. Can I change the
after
height?
120 plus episodes, that may be my favorite answer
Oh,
ever.
very good.
It might be. It's right up there. That's a top 5 for sure. That might be number 1 though. That's
Yes.
amazing. I'm taking it. I love it.
That is
I'm
very
going with it.
spontaneous. I did not plan that one for
Hey,
sure.
first thing that comes to mind. Richard, you are playing the game well so far.
Thank
Very
you.
well done. Question number 3. If you could go back and be the inventor of any dental product, And no, you can't choose your own. Which one would you choose and why?
I can't. I don't think I could answer this with great quality because I don't know that many dental products, honestly. But I'd like to instead posit um more impact. And I would say someone that comes to mind, and by the way, I'm relatively new to the dental industry. Um, but when I think about someone like Christian Gordonson and the impact he
Gordon
has made,
Christensen.
Gordon Christensen, sorry, look at that.
That's all
All
right.
stretched
Christian
out here.
Gordonson might be his evil twin or something. I'm gonna reach out to him and let him know.
Oh my God, look at it. I even messed up his name. But but rather what uh, rather his brand and the impact he's making as a person. And then, yes, I know you're talking about devices and services, but the impact he's made and how people show that respect. I met him at a conference one time, very professional, first class dresser, and I was like, wow, that is someone to aspire to. And so I know it's
I
not really
love
the
it though.
answer you're expecting, but
He
that's
is
what I would say.
very genuine and authentic when you meet him. You can tell he's just a very giving person. I love that answer. I think it's great. Well, Richard, I want to respect your time, my listening audience time. Is there anything I haven't asked you or that you really want to share with my listening audience before we close the episode here today?
I just think that team alignment. I think I would like to leave this with a take-home message. Team alignment that has been, especially in what I do, that has been stress tested is critical. And so how to make that happen, reach out to me, and how maybe I can have a little conversation and how that I can help or, give you some advice. I think that would be something to consider because I think team alignment that has been stress tested, that's what all the best teams do when under duress. Do they know how to perform? And so you can reach out to me. I'll put my contact information in the show notes or my website, drrichardmarn.com, drrichardmarn.com. I think that's another way to, if you want to find out more information. Or you know what? LinkedIn. There you go.
What a beautifully way to state a closing for a show about team alignment, which definitely is aligned in conjunction with what we talk about here on the Tooth Sleuth Podcast and what we're all about at G&A Consult. My guest today on the Tooth Sleuth Podcast has been Dr. Richard Marn, co-founder of Blue Pacific Medical Simulation, all about emergency preparedness and trying to ensure that especially no pediatric patients ever face a situation where they don't have an opportunity to turn back from that emergency situation due to anesthesiology. Thank you so much. It's been a very enlightening conversation, and we'll make sure that we get everything in the show notes, including those 4 pillars in the free resource that you so generously shared. Thank you so much for being a guest today.
Thanks for having me, Greg.
If you need help with converting lead calls into consultations, closing consults into more full arch cases, or creating a more strategic marketing message and branding for your practice or group, follow me for more tips or reach out to G&A Consult for a discovery call today.